And we'll see if, there we go.
Beautiful. You want me to start, Renee, or would you like to start?
Let me get the agenda up
Mhm.
really quick. Oh. Okay. All right, so we're going to go ahead and start the Community Health and Safety Task Force meeting for November 15th, 2022 at 5:37. And Valeria, I think you're going to do the roll call.
Thank you, Councilwoman Villarreal. Welcome, everyone. Welcome to the Santa Fe Community Health and Safety Task Force meeting. Thank you for being here. Roll call for this evening. Call out everybody's name, correct? Renee Villarreal,
Present.
Gino Zamora,
Present.
Marcela Diaz,
I'm here.
Annie Raskin.
Present, and I apologize, I have to leave early tonight.
Thank you for letting us know, Annie. Emily Kaltenbach,
Present.
Mary Louise Romero.
Here.
Great. And we know that Bruce and Chris will be a little delayed. We have our community member, Sarah Grant. Welcome once again, Sarah. And we have presenters this evening, Bruce from Cerna Solutions and Dr. Sanchez from the Center for Social Policy, UNM. And in support, Julie Sanchez with the City of Santa Fe and myself, Valeria. We are going to move to approve of minutes for the last meeting, November 1st, 2022. Yes, thank you. Thank you, Marcela. Who would like to motion to vote? Were there any questions about November 1st meeting minutes at all? No.
Just want to know Valeria is
I have a question.
Monica Alt is excused from our meeting.
Yes. Go ahead, Marcela.
You know, are breakout groups in the minutes?
Mhm.
So everything that we say in our breakout groups, even though it's not being recorded, I don't know. So everything that we say and do in our breakout groups is public record. I just want to make sure that I didn't know that, and so I want to make sure that we all know that.
Where are
For
you
some,
seeing it? Where are you seeing that it's
You
noted?
shouldn't be.
in the minutes, I don't know. Like maybe I mistook what I read in the minutes as notes from our breakout sessions, and I was like, oh.
Are you referring to what Val put together and sent out to everybody? Or
Perhaps.
it is not
Looked like
recorded.
minutes to me, like it had roll call and all that stuff, but maybe it wasn't the official minutes. Okay, just checking. I just me quedé con la duda. I had the doubt.
Valeria gives us like kind of a summary of things, especially like if we have action items. What's in the notes, the minutes, official minutes is in PrimeGov, and it basically tells us who is present and who attended, and that the task force members went into their respective breakouts. And that's
Got
it.
it. Thank you.
Great question, Marcela. Thank you. So who would like to vote? Motion to vote.
We need a motion in a second.
Mhm.
I realized I made a motion, but I wasn't here on the first, so I have to recuse myself. Sorry.
Right, I wasn't here on the first either. That's why I'm refraining from the motion. I'll
Make the motion.
I'll ultimately vote. But
And I'll second it.
I move that we accept those minutes.
We have a
Okay.
second from Annie.
Oh, a second from Annie. Okay, and then I'm going to take roll call. Let me just write this down. Okay, so roll call again. Renee Villarreal,
Yes.
Gino Zamora,
yes,
Marcela Diaz,
Yes.
Annie Raskin,
Yes.
Emily Kaltenbach,
Yes.
And Mary Louise Romero.
Yes.
Beautiful. Roll call. Okay, and then communications from the chairs.
Mm,
Should we wait or
I think, I don't know.
what would you like to do?
The only thing I was just thinking, I'll think out loud with you all, is we have quarterly reports. So technically, the fourth one for this year would be in December. And we only have one meeting in December and it's always packed and a little nutty. So I'm thinking maybe at the first meeting in January, we could do our check-in, not check-in, but update, our quarterly update. And then we'd probably have more information to share as it relates to the community outreach plan and strategy. So just wanted to see what you all thought about that. If there's any opinion about it.
Yeah,
Great idea.
sounds like a
Nice.
good plan.
Mhm.
Okay. So I'll check into, so we can reserve that spot
Mhm.
for our presentation.
Is it
Um,
okay if I don't go in person?
Yes. Sorry, Gino. Oh, yeah. He was hungry and he had to wait way too long. Actually, everybody had to wait long.
Mhm.
So, all right, well then we'll plan for beginning of January. And that's all I have from this seat. We can move on to communications from staff and
Mhm.
facilitator.
Let's start with communication. Oh, that would be me. Okay. No, it was that actually checking in about our next quarterly progress report and then we don't have to do this now, but I'll request a meeting with you and Chris, Renee, so that we can look at that framework of presentation and reporting for January. So I can start putting that together and then share with the council members for their input. So that would be it for me. Thank you. Julie, do you have any?
This is shocking, but I don't think I have any updates. So thank you.
Thank you. All righty. So we are going to welcome our friend Brian from Cerna Solutions to provide an overview of the 988 resources. And then we'll move into the work with Dr. Sanchez when we do the working group updates. So take it away, Brian, and welcome. Great to have you here.
Great. Julie, can you make me a co-host so that I can share my screen?
Done.
Awesome. All right. Hold on one second. Technical difficulties. There you go. Can you see it correctly on your screen? It should be big. Is it big?
Not yet.
No?
It's still in the slide.
Oh,
Yeah.
hold on.
Uh-oh, I think we lost him.
Uh-oh.
I'll let him back in. I think he accidentally left the meeting.
Yeah, I closed the wrong window.
He closed out of the meeting instead of the.
Yeah. I'm glad I didn't make him a co-host because then he would have shut down the entire meeting. It would have been bad.
Sarah, I was just curious if the link worked that I sent you via email right before we started, or if
That-
the one.
That link worked great. The other one didn't work at all. The
Okay.
one, yeah.
So thank you for sending it, because I just tried the other one first and then went, what's that? But then I saw yours and here I am.
Thank you. And we still haven't figured out what is wrong with, it works when staff test it out, but I have a feeling it's because they're hosts. I don't know how that works, but you know, sometimes it's kind of, Zoom is kind of wonky that way. If an
Yeah.
external person tries to sign in, it may not work the same way in the webinar format. So we'll just have to figure that out, because they tested it again and it worked for them. So
Mhm.
I don't know what the problem is.
Yeah.
No, there he is.
That
Yeah.
was embarrassing. I thought if I closed my laptop, that would just make the screen like show up the correct way. And that was a mistake. But I'm back and I'm ready to go. And I think I know what was wrong. So we should be good right now, right?
And Brian, are you going to tell us a little bit about yourself first?
Yeah.
Okay, excellent. Thank you.
Great. So I was invited to talk about the new 988 Behavioral Health Crisis Lifeline, which is what I will do, using a state-approved set of slides that I developed along with my colleague, Emily Everhart. And so my company, Cerna Solutions, we are Santa Fe based. We do have offices in both Santa Fe and Albuquerque. We are an outpatient mental health, behavioral health provider. But we're also a training organization, and we provide training on behalf of the state, different counties. Large organizations will contract with us to provide direct training to them, like PMS, Presbyterian, that sort of thing. So we do a lot of training in the behavioral health space around. This is one of the small trainings we do. We do training on culture, ethics, evidence-based practices, all that good stuff. And just me personally, so I am a Santa Fe native, graduated from Capitol High, went to Alameda Junior High School back when it was a thing. And this is where I chose to raise my family. I moved away for a bit. I'm one of those boomerangs where I moved to Albuquerque for a job, then I moved to Oregon for a job, and I decided to raise my kids around my family. So we all moved back. My wife's family is also from Santa Fe, so strong ties here. And I used to be on the Human Services Committee. So I was working with Julie for a lot of years on that. And so I did my service. I might do it again someday. But yeah, I was on that for quite a while, quite a number of years.
Brian, I will take you on any one of my committees any day.
Thanks, Julie. It's good to know when I'm ready. I do look forward to doing that kind of thing again. All right, so we're going to start with a land acknowledgement. So before we begin, we want to acknowledge, take a moment to acknowledge that we are meeting, living, and working on traditional and unceded lands of the indigenous people who call New Mexico home. Here in Santa Fe, that is primarily Tewa-speaking people, and but really all indigenous people. They call New Mexico home. They have deep connections to the land, have made significant contributions to the broader community statewide. We honor the land itself and those who remain through the strength and resilience of many generations. So what is 988? So 988 is a behavioral health crisis line. And one thing I do want to just point out at the beginning is we're not calling 988 a suicide prevention line, because that pigeonholes it a little too much. So 988 is a national effort to have a very easy to remember 3-digit number where anybody who's experiencing a behavioral health crisis can dial those 3 digits and be hooked up with a licensed behavioral health clinician anywhere in the country. So it's not a New Mexico specific effort, it's national. And it went live on July 16th nationally. Prior to that, you could have dialed 988 actually as soon as the beginning of this year. And it would have just connected you to the National Suicide Prevention Hotline. But now when you dial 988, it connects you to NMCAL, the New Mexico Crisis and Access Line. And the idea is that we want something as easy to remember as 911, so that people dial that number instead of 911 when they're having a behavioral health crisis. What is a behavioral health crisis? So thoughts of suicide definitely is a behavioral health crisis. But again, we don't want it to be targeted to only people who have reached that point to where they're contemplating suicide. We want people to call this line, you know, in that process before they get to that point. So a behavioral health crisis is any kind of, really it's any kind of emotional distress. It could be related to mental health issues, mental health symptoms, a traumatic event, just cumulative stress from living in this post-pandemic world. It really doesn't, in other words, somebody doesn't really have to have a need. They definitely don't have a diagnosis. You know, it can be any one of us can call 988. People can also call 988 if they are worried about a loved one who may need crisis support. So one version of a 911 call could be that, let's say I have an adult child living with me and they're experiencing an emotional crisis and they barricade themselves in the bathroom, right? And so I can either break the door down or, you know, do something really provocative, borderline violent, or I can call 911, have law enforcement show up and say, my daughter's locked herself in the bathroom. I think she's going to hurt herself, right? But you call 911 and you have a law enforcement response. The idea here is that you would call 988 and you'd have a licensed therapist, counselor on the other end that can actually help you first talk yourself down and then maybe talk your loved one down too. And then maybe even you just pass the phone over to your loved one who is having that emotional crisis. And law enforcement is nowhere on the scene and nobody's going to jail and nobody's, you know, none of that's happening. That's the vision, is that 988, you know, puts a process into action that is specific to a behavioral health need. So these are just some precipitating events of a behavioral health crisis. So someone losing their job, someone losing an important relationship. This could be through grief, like the death of a loved one. It could be the termination of a romantic relationship. It doesn't really matter. Just any kind of loss of a relationship can be experienced as a crisis. When substance use or abuse reaches a breaking point for the caller or for a loved one. By the way, that is just one quick plug. That is one thing that we specialize in at Certain Solutions, is we have a program specifically for families who have a loved one with an addiction. We work with the families. We also work with people with addictions, of course, but we're the lead organization in the state for this evidence-based practice called CRAFT, which is designed to help families who have a loved one with an addiction. And I just mention it because we're the only ones really doing that. So people running out of psychiatric medications without access to refill, people experiencing a traumatic event or witnessing one. These are all things that might precipitate a behavioral health crisis. Why do we need 988? So we just had an election, and I think a lot of us can agree that Americans are pretty divided, you know, politically. And so I think that this first bullet point is really telling. It says 3/4 of Americans are not content with the status of mental health treatment in this country, regardless of political affiliation. And while 72% of respondents of a national survey have a favorable opinion of law enforcement in their own community, 4 in 5 people believe that mental health professionals should be the primary first responders when someone is having a mental health or suicide crisis rather than law enforcement. 911 diversion to 988. So that's actually people calling 911 and the operator diverting the call to 988. That is a up and running in some communities in the country. It's definitely not everywhere, and it's not in Santa Fe yet. But when that happens, that 911 diversion to 988, it's been proven to be more effective. Americans do not believe that those having a mental health crisis should be taken to jail or into police custody for help, which happens frequently in many communities. This is really true. It's true in Santa Fe to some degree. It gets even more true when you get into the rural areas of the state, where the local county jails are often places where you house the mentally ill and people with addictions. So the goal is to respond to behavioral health emergencies with trained behavioral health professionals rather than law enforcement. That's the national goal, and that's also the state goal. It's also more fiscally responsible. Additionally, expensive ambulance trips and hospitalizations can decrease, reducing the burden on the healthcare system and allowing access to care in the least restrictive way. So how is 988 different from 911? 911 is not going anywhere, and we'll always need 911. But the idea is that 911 is already understaffed and overburdened, just dealing with law enforcement issues. Forget behavioral health, right? I can't tell you, somebody in this meeting might know, but there's probably a dozen vacancies, between the county and the city's law enforcement departments. And those aren't going to get filled anytime soon. And so our law enforcement officers are already overtaxed without having to deal with behavioral health issues. And same thing with our paramedics and fire department. I have actually worked with the fire department a lot over the years, teaching them different things to help them in the field with behavioral health crises. And unfortunately, for some of them, it's the majority of their calls. And that's not even the MIHO part. Just in general, paramedics are often responding to people with addictions and mental health issues that are homeless. And that's a lot of their job. And of course, we want to train them up, but it would also be great if we could have not a paramedic respond and a firefighter, but a trained therapist and a peer support worker. That's really the model, is somebody with lived experience and somebody with clinical acuity to address the situation, both. So this graphic, this busy graphic that you see in front of you, it's from the national model of how the idea of how this is supposed to work when every piece is in place. And so you have a person in crisis and they call 988. Instead of calling 911, they call 988. So you don't tie up the 911 operators first and foremost and allow them, because those positions, by the way, are understaffed everywhere. 911 operators are, those positions are, there's a lot of vacancies, a lot of overtime and already for 911 operators. So we want to stop people from calling 911 and going straight to 988 so that we don't burden those operators. If they do call 911, the idea is the 911 operator can then send them over to the crisis line. Again, we're not there yet. We expect to get there probably within 3 to 5 years nationally. Then different communities will get there sooner than others. We just don't know exactly when that's going to happen, that capability for 911 to pass the call over. But the idea is a person in crisis calls 988, they talk to somebody who's trained in crisis intervention, and 80% of those issues are resolved on the phone, no other action necessary. Somebody needed somebody to listen, somebody needed somebody to validate them. They just needed to talk to somebody and they did, and it's resolved, and that's 80% of the time. If it's not resolved, then the idea might be to dispatch a mobile crisis team. Santa Fe, we are lucky to have that. And then the mobile crisis team then responds, and when they respond, 70% of those issues are resolved in the field, no other action necessary. If that doesn't work, then perhaps they need to be taken to a crisis facility. So for us, this is La Sala. And so for those people that wind up in the crisis facility, they can stay there until they figure out their next move. And the idea is that 65% of those are discharged back into the community, and the rest are discharged into some other service that they need. The most frequent being detox services provided in our county by the Santa Fe Recovery Center. And then after that, the idea is to give post-crisis wraparound services where people just continuously check on that person, make sure that they're making appointments or following through with whatever they were referred to. And all of this leads to decreased incarceration, decreased ambulance transports, and decreased inpatient hospitalization. Which means that we want to move to something that is the least restrictive and least costly for all of us, including the person in crisis. So who can access this 988 crisis line? Anyone who needs a behavioral health related crisis support can access 988 through voice, chat, or text. So in our state, 80% of those calls go to our local crisis line, which is NMCAL, New Mexico Crisis and Access Line. The 20% that don't go to NMCAL, there are very good reasons for that. One of the reasons is if you are a veteran and you call 988, at the very top of the call, you'll hear a message that says, if you're a veteran and would like to speak to another veteran through our veteran crisis line, press 1 now, right? And then it puts you through to a national veterans hotline. Some veterans just prefer that. And then if someone speaks Spanish, they get routed to one of 3 nationwide Spanish-speaking crisis call centers. And I know what some of you are thinking, why on earth in New Mexico, a dual language state with so many Spanish speakers, are we sending them somewhere else? It's because the New Mexico Crisis and Access Line cannot find enough Spanish-speaking clinicians to staff a 24/7 crisis line. They could definitely cover shifts, but they can't find enough people to do that 24/7 locally and reliably. So they can't hold themselves out as providing that service until they can get there. And because of workforce issues, I don't know if and when they're ever going to get there. So instead, it goes to one of 3 nationwide Spanish-speaking crisis call centers. Persons with hearing challenges can use the NMCAL TTY line, 1-855-227-5485. Also, 988 currently provides live crisis center calling services in English and Spanish and uses Language Line Solutions, which is a national organization to provide translation services in over 250 additional languages. Right now, text and chat are only available in English. I do anticipate that's going to change because again, this is a national effort. There will become national efforts to provide text responses and chat responses in other languages. First and foremost, Spanish, probably being the one that they handle first. So what happens when people dial that number? Well, first they hear an automated menu that says, dial 1 if you're a veteran, dial 2 if you need Spanish. And then a trained crisis counselor will answer the call, and NMCAL shoots for answering within 20 seconds every single call. They usually do that. And then their job is to listen to the caller, understand how the problem is affecting them, provide support, and share resources if needed. And if for any reason the NMCAL cannot take the call because all their operators are tied up, then it goes to Agora. So Agora is a program that's been around for decades, and it's through UNM, and they train volunteers on crisis support and crisis counseling. And so if NMCAL can't take it, it goes to Agora, and then if Agora can't take it, it goes into the national 988 call center. What happens when someone texts? That goes to an MCAL. And MCAL has taken that on and it's live. It's been live since July 16th. And so that doesn't go to a national center, it goes to an MCAL. What about chat? So who uses chat? It's primarily professionals, people that are in front of a computer all day. They go to this website and you can start chatting in a very discreet way, even at work. So that's the idea with the chat, is it's going to be primarily professionals, and it's a really nice way for somebody to get some support without excusing themselves to make a personal call, or having someone overhear their phone call. They can do it very discreetly, and it doesn't look like they're texting on their phone. They're at their workstation, and they can chat with a full keyboard. That's another advantage of chatting over texting, is you get access to a full keyboard and some people can express themselves better. So what about privacy issues? Will geolocation be used? So geolocation is that feature that 911 uses that allows you, if you call 911 and you're non-responsive, they can use geolocation to find out where you are and send somebody, send some emergency medical services and law enforcement to your location. So that's geolocation. 988 does not use geolocation. It can, if needed, access 911 and activate 911 to use geolocation. But it's 911 that uses geolocation, not 988. And the primary reason is that at the federal level, the feds are not interested in activating geolocation for 988. They're afraid, because of the stigma around behavioral health, that if people feel like somebody can see who they are, where they are, that kind of information, that they would not use the service. So at the federal level, SAMHSA has said we are not going to pursue geolocation for 988 in general. By the way, one thing I didn't mention, when someone calls 988, one of the first things that the crisis counselor does is, it's a lot like any other phone call you make. They'll say, hello, who do I have the pleasure of speaking with? Right? And you can give them your name, or you can make up a name, or you can say, I prefer not to give you my name. But they start with that. They say, who am I speaking with? And then they say, do you have a phone number in case we get disconnected? I can call you right back. And then they say, if you feel comfortable, could you give me your location in case we have to call 911 to dispatch emergency services? Now the caller can say, no, thank you, no, thank you, no, thank you. And then the call continues, right? The counselor, that's fine. What's going on? Talk to me. What's your crisis? Right? But they will at least ask for those pieces of information, just in case. Just in case. They can save a life. So, at the end of the call, they usually ask for demographic information. And one of the reasons why we ask for demographic information at the end of a 988 call is we want to see who's utilizing it. We have suspicions that young people are going to text more than call, that older people are going to call more than text or chat, and we're not exactly sure who's going to use the chat. So we're collecting that kind of demographic information to see where targeted outreach needs to happen, who's utilizing what, and just that kind of information. But we're not trying to collect data that would in any way out somebody in a community for having an issue. So how is it being funded? Mostly at the federal level. There is money that has been allocated to go down to states to implement 988. And I know that our state got some funding through Senator Heinrich's office. And, we're talking, somewhere in the millions, which feels like a lot of money until you're realizing that we want to build something that is used as widely as 911 from scratch, kind of. But I will say, one of the things about New Mexico is we were only one of 5 states in the country that had our own crisis line. So that New Mexico Crisis and Access Line, it's an anomaly in the US. So a lot of states right now, they're either rushing to create their own version of NMCal, or they're just passing all these 988 calls to a national crisis center. So we are ahead of the game when it comes to that. And that was funded primarily through the state general fund kind of dollars. And so it's a mix of federal funding, and at this point, it's going to be some state funding to implement 988. But really, the sustainability is going to come from this law change that happened that allows states to enact a new telecommunication fees to help support 988 operations. So on your phone bills, you'll always see a little fee, and part of that fee goes to fund 911. And so the idea is that that's the ultimate sustainability with 988. You'll probably see that fee doubled. Some will go to 911 and some will go to 988. So that busy graphic that I showed you that has the crisis, mobile crisis response teams and the crisis triage centers, wraparound services, you put that all together, it's called the Crisis Now model. So it's more than just having the crisis line, which triggers a process for all those other things. It's having all of those pieces. That's the Crisis Now model. And you can actually go to a website where you type in your county and they'll model projected cost savings to that county based on the population size and that sort of thing. And so I did that for San Juan, Bernalillo, and Grant County, 3 New Mexico counties that are very different. But the moral of the story, if you even just at a glance, you can see that no matter what the county is spending, they can expect to reduce that by more than 50% if they implement the Crisis Now model. And this is it's comparing the Crisis Now model costs versus ED and IP only scenario. And so that's emergency department and inpatient hospitalization costs. We're not even looking at incarceration costs or police overtime costs, right? Or even correctional officer overtime costs, because those positions are, usually there's a lot of vacancies in those positions and turnover in those positions. So we can expect if everybody starts using this Crisis Now model, in the long term, it's going to save counties a whole lot of money in what is already given to hospitals and jails and law enforcement. So some studies that look at the cost benefit analysis. So in Washington State, their Institute for Public Policy, they demonstrated cost benefits to the criminal justice system and psychiatric hospitalization. And people were less likely to be placed in jail or a psychiatric hospital once they implemented the Crisis Now model. In Arizona has actually had all the pieces to this puzzle for many years. They're one of the leaders in the country as far as all of these services in the Crisis Now model coming together seamlessly. And so there's some good data coming out of there that's at this point already years old. But for example, Arizona's Recovery International Crisis Recovery Response Center, they looked at calls for law enforcement and they saw that they had been reduced 75 to 80% with 22,000 law enforcement handoffs to mobile crisis teams yearly. And the mobile acute crisis in Pima County, Arizona, in 2014, there were 4,433 law enforcement transfers to mobile crisis teams, saving 8,800 hours of law enforcement time. So that's a lot of savings, especially if it's overtime, law enforcement overtime. That savings is huge. So RI International, they are the ones that are currently running the their version of the Crisis Triage Center in Doña County. It's run by RI International. And so they actually run crisis centers all over the country. Ours is run by New Mexico Solutions. But just so you know, this RI International, they're a major player at the national level for this model. And we happen to have a gentleman that lives here in town, Dr. Wayne Lindstrom. He works for RI International, and he's very, very deeply involved in the crisis care rollout nationally. So he's a local resource. If you ever want his contact info, let me know. If you don't have it, I know he makes it around, so you might already know him and have it. So how will it be rolled out in New Mexico or advertised in New Mexico? So before July 16th, there wasn't a whole lot going on as far as public outreach because it hadn't gone live yet. Since then, there's been a lot more effort in getting the word out. If you drive between Santa Fe and Albuquerque, you'll see, I think, 2 billboards advertising 988. And it's being pushed out on social media. There's also some television commercials that I've seen on KRQE. At the national level, you'll start to see 988 being advertised more in the next year. They did want to give states that weren't ready for 988 to go live. They wanted to give them more time to get ready before they really start doing a public awareness campaign at the national level. But the idea is, like, 10 years from now, we'll see a television show or a movie where somebody says, instead of saying quick call 911, they say quick call 988. Right? We want it to be that well known, just in popular culture in general. And so there's also efforts like in public information sessions like this one. This one is supposed to evolve over time as New Mexico gets more pieces in place. But the idea is that Certain Solutions has a contract to do these regionally. And so it's always nice to do one in my own backyard. It would have been nice to do this in person too, but I just know that the limitations on that right now, especially with the spike we're having. But we do these regionally. We also do these online. We did a whole lot right at the kickoff, and now we're spacing them out to every other month. We did one online that was open to the general public yesterday during the lunch hour. And so, if you go to our website, or you can go to the 988nm.org website, 988nm.org website, and they'll list them there when we schedule some more. So this is the graphic that we're using in our state, the way we conceptualize a crisis now model. And and the idea here is it's more than just the mountains and the hot air balloon that make it New Mexican. The one thing that's different between this image and the image that you saw earlier are that, all of these connections are multi-directional. And that's what we really want in our state. We don't want this clean line of, if this, then this, then this, then this. We want basically a no wrong door policy. Like somebody can just walk into La Sala in crisis and start there, right? They don't need to necessarily go through 988 to access the Crisis Now continuum. They can go to the hospital, and the hospital then refers them to La Sala or wherever else they need to go to, so the idea is that 988 becomes what we're calling care traffic control. And the hope is that we move from crisis as a disruption in care to crisis as an opportunity for better coordination of care. We're not there yet. Even though in Santa Fe we do have a mobile crisis team and a crisis center, there are still some times when a crisis winds up with somebody, and this is really true for people who are not adults. So think adolescents, right? An adolescent in a crisis they might show up at the hospital and then get transferred either to Casement in Albuquerque or Mesilla Valley in Las Cruces, or sometimes out of state. And then they have to be medically transported to those other hospitals. So that's an ambulance ride. And that's wildly expensive. And not only is that wildly expensive, it's hard to pull off. There are people that sit just waiting in hospitals right now for an ambulance to become available to transport them just to Albuquerque. They can wait a couple of days just to get that transport to Albuquerque. So there's still a lot of wrinkles in this, even in our beautiful city of Santa Fe, who has more pieces than almost anybody else in the state, other than Bernalillo County and Doña Ana County, which is Las Cruces. They might have at least as much as we have, if not more, pieces of the puzzle really kind of ironed out. We're pretty ahead of the game, and there's still a lot of work to be done to where we really get to this model of crisis as an opportunity rather than crisis as a disruption in care. And the problem, by the way, I didn't say it explicitly. If you place somebody in Caseman or Mesilla Valley or anywhere out of their community, or UNM for that matter, when they get discharged, they're just pushed out the door. You know, there's people right now getting discharged from UNM hospital, walking on a Lomas, saying, shit, how am I going to get to Santa Fe? Right? And that's even worse in Mesilla Valley, where, you know, in my job, I've sent people to Mesilla Valley to get stabilized, and then they get discharged, and we hear from them because they walked from the hospital to the mall, and then they've used a payphone to call a family member saying they kicked me out, or they discharged me. They said I didn't need to be there anymore. Can you come and pick me up? And now the family's scrambling, like, how are we going to get to Las Cruces to pick up, you know, this adolescent that's in our family that just got discharged? So that's a huge problem. And, you know, and it's still a problem. It is still a problem. And, but we're doing what we can. And this is a piece in that puzzle. But just having this crisis line doesn't solve all of our problems. But the idea is that it starts to build an infrastructure to where people are communicating better. And it's more seamless, the care. All right, I'm just doing a time check. So I'm gonna speed up a little bit. Because I did get a little bit of a late start, and I'm supposed to heat up dinner for my daughter and wife, who are both, you know, at practice or working late too. So mobile crisis teams, when we get there, they're going to be dispatched by the 988 call center. That doesn't exist just yet. In Santa Fe, the mobile crisis team is dispatched by 911. And right now, that's the way they want to keep it. But that's a uniquely Santa Fe phenomenon. Nationally and statewide, what we really want is for those mobile crisis teams to be dispatched by the 988 call center. And it's, so, you know, ideally it's a 2-person team heading out, and that would be, again, a peer support worker and a licensed clinician. And statewide, the idea is that 2-member team responds within 90 minutes, 24 hours a day, 7 days a week, 365 days a year. In a place like Santa Fe, that's way too long, 90 minutes. But once you get into a rural part of the state, like even when you get into tribal communities or like the Navajo reservation, 90 minutes would be a huge improvement to have a response. So that's the goal statewide, is 90 minutes. Even in rural and frontier areas. In urban areas, the idea would be that it would be 20 minutes or less. Those mobile crisis response team. That team provides crisis intervention, screening, assessment, and referrals, as well as transportation to whatever the next step might be. If the mobile crisis team gets on scene and they feel that law enforcement is needed, then they are the ones to call 911. That's the national model. And again, in Santa Fe, there's some resistance to that. They feel that no, law enforcement should be there first, and then we'll show up. And just nationally, we know that I understand why that's happening the way it is. The person is trying to protect the behavioral health staff. They don't have guns, they don't have badges, right? They're trying to protect their staff. But if we're really trying to protect the caller, the person in crisis, people who show up with badges and guns, often nationally, exacerbate the crisis and make everything a lot more dangerous than if somebody, in a sweater and a scarf show up, and say, we're here to help you, right? They de-escalate. Their very presence is de-escalating rather than escalating. So again, that's the national model. MCTs are dispatched by the 988 call center. Then we have these crisis centers. So I don't need to go into this too deeply. The one that we have in Santa Fe is operating on what we call the 23-hour model. That doesn't literally mean it's open 23 hours. It just means that it's not open 24/7. Once you have something that's open 24/7, then basically it needs to be a hospital because you need to have round-the-clock staffing. The staffing pattern changes pretty dramatically, and the cost changes once you do 24/7. But if you do 23 hours or less, the costs, they just don't exponentially increase. There's also a 14-day residential model. These two models can be combined. Right now, there aren't any children and adolescents crisis triage centers in the state. When we do get those, they will have to be a standalone program. You can't have children and adults in the same facility. And these facilities can provide limited detoxification services. That's actually the best practice. That doesn't mean that somebody needs to complete detox in that facility, but they can start detox and then get transferred over to the detox facility. And ideally, that whole no wrong door policy in a place like La Sala, by the way, is actually the building of two programs. The New Mexico Solutions and Santa Fe Recovery Detox Center. And in an ideal situation, somebody can go into La Sala and then just walk across and get detoxed and enter that detox program. That's not how it works in the real world for a lot of complicated reasons that we won't go into today. I'm going to skip over this. In some rural areas or frontier areas, all they have is a regional hospital, and the idea is that they'll just contract with a behavioral health provider to respond within 30 minutes. That's not what we're doing. We're also not doing this model, which is a frontier area. Basically, they're getting creative, and they're allowing mobile crisis teams to just rent a room for the night or the day in a local motel and set up shop as a, de facto crisis triage center anywhere they can, really. But again, that's not necessarily an issue for us here. We have a mobile crisis center. We have a crisis triage center. It's getting late, so I'm mixing my words there. But we do have a lot in this in Santa Fe. So there is a woman, my colleague, Cindy Sackerman. She's involved in coordinating New Mexico Mobile Crisis Team Learning Community, where communities who operate mobile crisis teams or want to stand up their own mobile crisis team, they get together at these facilitated meetings and they learn from each other. They help each other stand up the service. So that's her contact info if you want to get a hold of Cindy. I'm going to put my contact info in the chat, just in case anybody wants to get a hold of me for any reason at all. I'll give that to you right now. But at this point, it's open for questions, comments, reflections, reactions to where we're at as a community with this, or what sticks out to you as far as the whole effort. So I'll yield to anybody who has those questions or comments.
Thank you, Brian. Thank you so much for all the information. There was a lot there, so maybe you could send us a slide deck.
No problem.
The group,
yeah,
or send it to Julie, and she can get us the information. I know we have a couple questions. Let's see. Let's start with Emily Kaltenbach first.
Thank you. And Brian, thanks so much. This was incredibly helpful as I've been reading different things about it, and it was really nice to see, how it's being implemented here in New Mexico, and helpful to put it in the context of Santa Fe. I was particularly pleased to hear about sort of the privacy pieces of it, and the self-direction of the 988, because I'm particularly concerned that people are scared to call these hotlines, because in the past, as we know, there's been a lot of surveillance, or their data is shared, and so I'm really happy you covered that.
It's also, Emily, if I may, it's also a real concern for the immigrant community. Fears around ICE somehow, some way getting notified that they're calling. And that's one thing about the national call center too, is they'll have no idea where that person is. Wherever that national call center is, probably in Texas or California. So, and they have no access geolocation. Even if they, once it goes national, even if there's an emergency and that national team tries to call 911, there's no way they can do it, really. Because this, and just briefly, this reminds me of something I forgot to tell you that's really important, is the way 911 operates, right? It operates off of your location. So I'm traveling in Las Vegas, Nevada. I call 911, it rings Las Vegas, Nevada 911. The way 988 operates is off your area code. So I'm traveling to Las Vegas, Nevada. I call 988, it rings in Albuquerque at NMCal. So, and that's because geolocation isn't used. So this is an issue, by the way. So my son, for example, he's living in New York City. When he called 988, it's going to ring in Albuquerque. If he wants to get a hold of local resources in New York City, he's going to have to find the New York City line to New York City's crisis line. So that's just something I forgot to mention, that it's an issue. And it's because we don't use geolocation that it automatically routes based on your area code. And people move states and keep their same numbers all the time now. So, somebody who just moved from Colorado, it's going to ring in Colorado. And Colorado is not going to have access to, and MCAL has access to this thing called open beds, where they can see different providers and who has room, and they can make these cute little referrals on the back end through their internal system. That's never going to be linked nationally. Well, I shouldn't say never. It's just, it's just a New Mexico based system right now. So I'm sorry I hijacked your comment, Emily, but that was an important piece that I forgot to say.
That's really helpful. Because I have a couple follow-up questions just on that. So you mentioned that, so there's no geolocation, but there are times that the call center can use geolocation through 911. And I'm just curious, is that through an imminent threat? What is the algorithm to decide, or the information to decide to get 911 involved? And is the caller notified at the top of the call that they might get involved? I'm just curious, because of course, what someone's saying on the phone and what someone's hearing can be really different. And we know a lot of sort of the response for folks, who are most vulnerable in our system can be, those individuals might have a higher rate of 911 getting involved because the call center thinks that they should. I'm just curious about that, and how they're sort of informed at the top.
Sure. So at the top of the call, they're asked to give their name, phone number, and address, but it's all voluntary. And they're told, would you like to share your location with us in case we need to alert emergency services? And they can say no, they can say hell no. They can say whatever they want to, or they can give a fake address, really. I mean, because geolocation is not a factor, it's really up to the person who's calling how they share their information. And as far as the algorithm, once it's determined that there's imminent threat, the way it's been explained to me is, you picture a call center, somebody on a computer hits a button that alerts a supervisor who then can listen in on the call. And the procedure, the protocol is that they say, by the way, my supervisor is going to be joining the call with us. They're going to be listening in. And if they need to call 911, they will call 911 so that you and I can continue talking and I don't put you on hold. They're going to do that for me. You know, is that okay with you? And at any point, the person could just say, oh my gosh, you know, this is not what I want. And they hang up, and then there's no way to call and find their location, right? And even at that point, when the supervisor called 911, it's not like they can do a wire trace through 3 phones or anything. They have to ask the supervisor, do you know the location of this person? And if the supervisor says, no, they didn't give that to me, then they say, well, why did you call 911? Right? Because they can't do anything. They literally cannot do anything unless the caller shares that information. And the protocol is that the caller does know when that call is happening to 911. You know, and they keep them on the line until the emergency services show up.
That's super helpful. I really appreciate it. And that
Sure.
clarity. And just my last quick comment is just, I also really appreciate how you talked about the peer being involved in a mental health specialist, being the first point of contact instead of 911. And I know Santa Fe is doing it differently. Maybe that I would just flag for our group to think about whether that's a recommendation, to think, you know, taking more of that national recommendation of having the mental health and peer individual as first point of contact. So thanks so much for your presentation. I appreciate it.
Sure.
Go ahead, Lydia.
Thank you, Emily, and Brian. Thank you for the thorough follow-up to the questions. Gino, I believe you were next, and I think Marcela, did I see your hand go up? Go ahead, Gino.
It's common in our presentations that I just sit in awe of what's going on out there. So you know, Brian, thank you for bringing depth to 988. You are right that the public doesn't understand it yet. And just myself viewing your presentation and really the opportunities for someone in crisis to reach out to you, that's not necessarily a suicide crisis. That's a really important distinction. So to understand the breadth and the depth of 988 has been very helpful for me. And so I thank you for that. It's just appreciation. I don't have much of a question because you've been pretty thorough.
Thank you, Mr. Zamora.
Gino, please.
Gino.
Thanks, Brian.
Thank you, Gino. Marcela, did you have your hand up? Julie? Okay.
I have a
Anybody
question,
else?
Lydia.
Go for it.
Just quickly, you said, so right now Santa Fe's not, the 911 is not diverting to 988 at all?
Right. But that's not necessarily a problem to fix just yet, because the actual training for 911 operators hasn't been developed yet. So the idea is that they need to develop training for 911 operators for them to even determine what a behavioral health crisis is. And so that's still being worked on. What I did say that's unique to Santa Fe is that the crisis response team is not triggered by 988, but 911.
Right.
And that's not necessarily unique. What's unique about Santa Fe is there's actually no desire to change that. In fact, it's the opposite. You know, they want to stay under 911 because they want that law enforcement presence to clear the scene before their staff get there. And that's unique to the contractor. And I know, I feel like I'm, you know, all I'm saying is just what I know from talking to all parties involved. And again, I'll say, I understand the contractor's perspective of wanting to protect their staff. But that's the part that's unique to Santa Fe Council.
So is there a plan that 911 will be trained to divert to 988?
There's a plan, but a lot of pieces of the plan are still on paper and haven't really been executed. So I would guess that that's going to take probably another 2 years for that to happen in any kind of real way. But I don't know that to be true. That's just my estimation based on how I see these things move at the state level. But it'll be a statewide effort, if not a federal effort, to train 911 operators and to recognize and triage a behavioral health call and transfer.
Got it. Thank you.
Sure.
Thank you, Renee. We have Chris. Hi, Chris. Welcome. You have your hand
Hi.
up. You have a question?
Yeah, thank you. Thank you for the presentation. I was wondering if you knew that Santa Fe has an alternative response unit and
Mhm.
kind of how 911 works with the ARU as well as you, or how 988 works with the alternative response unit, if there's any.
Yeah. So the alternative response unit, since it's housed under law enforcement, even though it has a social worker as part of it, which is amazing and awesome, until 911 integrates with 988, it's always going to be triggered by 911, which, you know, just the point I was making, that nationally and statewide, the hope is that first responders to behavioral health crises will eventually not involve law enforcement at all. You know, that even though that's the hope, that's never going to happen. Law enforcement officers will always be, whether it's a behavioral health call or not, they're there and it's a behavioral health issue. So law enforcement officers in general, all law enforcement officers need to be trained in how to recognize and respond to behavioral health crises, and having a social worker as part of an ARU is the great, you know, asset to the effort. But it is different than the crisis care model.
Yeah, I did a ride along with our police department who I guess responds with the ARU, which is a social worker and a paramedic. And it was very apparent that police department is probably not needed in those situations. So glad to hear you talking about that, and just kind of reinforces, I think, what I came to discover. My background is in paramedic ambulance, so we always like to make sure the scene is safe before we go into anything, and it was clear that police probably not needed in those situations. So thanks for reaffirming that. My other question was, so I'm sure a lot of the 911 not going to 988 is probably has to do a lot with liability. How do we get past that? Is there anything we can do with state legislature, with help from council or other situations to try to get past that?
Sure, and that's not an effort I'm specifically involved in, but my understanding is that the Behavioral Health Services Division of the Human Services Division of the state of New Mexico is working on proposing some legislation that would address that issue, that concern of liability. And you know, that's not something I'm specifically involved in just yet. But if you email me, I can do a little bit of probing and find out who is involved in that, and I can link you. I'd be happy to do that.
Yeah, let us know how we can help. I think that's
Sure.
important.
It is vitally important, yeah.
Thank you, Chris. Thank you, Brian. Anyone else? Any other questions? Okay. Looks like we might be feeling complete. Oh, Mary Louise, go for it, my friend.
I just want to say, Brian, thank you. You always go over and beyond to make a positive difference. And I needed to say that because I was trying to message you and I couldn't. But thank you for being you, and to your family for making such a positive difference all the time. So that's it.
Thank you, Mary Louise. Thank you, thank you. Mary Louise, we just found out, not just found out, but she knows way more of my family than I ever knew. I always knew she knew my son from teen court, but man, she knows everybody in my family practically. So yeah, it's so good to see you here. It was nice to see you here, Mary Louise.
Beautiful.
Speaking of my family, my daughter's texting me. So if that's all for me, I think I'm gonna bow out, but I will send the slides to Julie and Val, and then they'll give them all to you. Thank you so much
Really,
for
yeah.
allowing me to be here. Thank you so much for everything you do for the city. Thank you so much.
Same to you, Brian. Really appreciate you. Thank you.
Thank you.
All righty, my friends. So next up on the list, Dr. Sanchez has joined us. Welcome, Dr. Sanchez. And he will be providing an update on process for the surveys and focus groups. So take it away, Dr. Sanchez. Great to see you.
So just quickly, that's actually part of our working group breakout sessions. Dr. Sanchez will be going with the other group and we'll be meeting with the policies and practices, hopefully with Julie, so she can give us an update on some of the questions and data we're still seeking. So thank you, Dr. Sanchez, for joining us.
I was hoping that that we, like last time, could all go into the working group, even though I know you do have to talk to Julie for a bit. Just because he's providing to us the sort of new and improved. He has some recommendations for cutting back, and it would just be great to get everyone's input. Is that okay, Councillor Villarreal, or no?
I don't really want to stay late, so I think Dr. Sanchez has limited time too. It's up to our working group if you want to go into the same working group. It's just we have stuff that hasn't been resolved yet that we need to talk about. So you tell me.
If you're comfortable with us, but he's also going to talk, and I know that he's not formally on the agenda, which is why we're doing it in the working group, but to talk to us a little bit about timeline and process for the whole community engagement process. We're happy to do it in our little working group, but if we could do it quickly, or you guys could leave.
Can we leave to another working group?
Mhm.
Well, I'm asking the hosts how that works.
Yeah, I could, so in the first working group, so the policies, who would want to come into the other working group just to hear a quick update?
Yeah, I guess it's just you, Counselor, and Bruce.
No, and also
No.
Gina.
And Gino and Val. Well, Val, I'll leave the room open if you want to just be in it.
I want to join the Dr. Sanchez update because I would like to capture updates for tomorrow when I send out the email to all of you.
Okay. So I will move you. Bruce, are you okay with being moved?
Yes.
Gino, are you okay? I saw a thumbs up and then Counselor. Okay, so we should be good to go then. So I will do that now. Thanks all.
Thank
Mm.
Sarah, I think we're by ourselves.
Are you talking to Julie or are you talking to me?
I don't see anybody else in this room.
No, I don't either. So she'll probably come along and figure out that you got dropped. I am not in a working group, so I think she sort of automatically dropped me. Yeah, so
I think we just wait until they figure it out that we're not there.
I agree.
Well, I raced, I'm on the public safety committee for the city also. So that's an in-person meeting at City Hall.
Uh-huh.
It didn't end till 5:35. So I listened to most of the presentation driving on 599 on my phone.
Because you live on 599?
No, because that's the way I have to get home.
Uh-huh. Okay, got
No,
it.
I live catty corner to the South Side Library
Uh-huh.
in off of Jaguar.
Yeah.
So
Yeah, so that's a long haul from downtown over to Jaguar. It takes about 20 minutes.
yeah, it's not bad.
Yeah.
I'm from Chicago. It takes you 20 minutes to get out of your subdivision. So
Yes, I understand. I'm not from Chicago, but I do know suburbs. So
Yeah.
so
yeah, no, it's not bad. This driving in New Mexico isn't that bad. We're being recorded though.
Really?
Yeah. So I don't know. I'd hate to leave. I wonder if I left and if I would be asked to go to another room.
I don't know. You're in the main room. We're both in the main room and the breakouts are somewhere else.
Yeah.
At least that's my understanding, but I don't know that much about Zoom. So
Let's see if I can. I'm going to chat. Oh, I'm going to chat everyone. Sarah and I are still
stranded in the main room.
feeling lonely. No, I don't want. Oh. I'm in another advocates group. We have an advocates group on the south side. And normally we would be meeting at 6 o'clock on the third Tuesday of every month. So third Tuesday of every month, I had 3 freaking meetings.
Yeah.
So, and so they decided to move that one to the second Tuesday, but it's nice. It's a nice advocates group. We get a lot of stuff done for our side of town.
Yeah.
Do you live in the city or?
I live in Renee's district. I lived
Okay.
kind of in the Baca Street neighborhood.
Okay, I know where that's at.
Yeah.
It's kind of, yeah, we weren't shown any houses there. Not too many homes are for sale.
No,
we
it's
bought-
true.
We bought this house in 2012 and
Yeah.
there weren't very many houses for sale.
Yeah. I bought my house in 2003.
I was still in Chicago.
Uh-huh.
Omaha from 2008 to 2015. Hey, come on, people, let us in the.
Yeah, I'm not sure we're getting any action here. And because I'm not generally invited to the breakouts, I don't mean to be inhospitable, but I might just leave you here.
Go ahead, because
Well-
if they don't get me into a meeting, into the policies and practices group, me too.
Yeah.
So I'll tell them you took off.
Yes.
I'll stay for a little bit, but not very much longer.
Okay, well, thank you. And thank you for all your service. And I hope someone wakes up to the situation soon and lets you back in.
Yep. Take care, Sarah.
See
Bye.
ya. Bye.
I'm by myself.
Yeah, let's see if Monica could do Monday. That sounds like fun. I just have to share that after 2.5 years, you're on mute.
Do you have COVID? I'm so sorry, Marcella. I wondered because I could hear your
My
stuff.
voice.
Yeah.
Yeah, it was not a big deal at all. It was like 2 days of flu and I'm fine. I'll have a cold for 2 days and I'll have upper respiratory sort of congestion for like 3 months. But it was totally leve, kept
Good.
my sense of taste and smell, worked. Don't feel like I experienced major brain fog. So all the things that I most feared didn't happen. So knock on wood. And the truth is, I was at a few meetings last week, completely masked. I was just the
You were masked,
only
or-
crazy person who wore a mask to these events. I was like the only one, and here I got it.
Well,
So
that's why I'm a little distracted because my best friend just texted to say she has COVID and I saw her on Sunday and I was just like, so now I'm like panicked.
yeah, no, exactly. I mean, part of it, I know this is going to sound crazy and I know we're being recorded, but I'm like probably going to, I'm going to probably go back to cleaning my groceries. No, only because I don't actually think I got it in contact with anyone when I wasn't wearing a mask, besides people that I know absolutely didn't have it. So who knows?
Well, I'm glad to hear you're feeling okay.
I'm on day 10 right now, and I felt fine after day 3.
Are you
and-
still testing positive?
Yeah, I missed a whole meeting that I needed to be at in Hobbs that we were hosting. And I was like, if I had followed CDC guidelines, because I've been checking my temperature, I could have gone. I could have gone and just wore a mask. But I'm like, I can do it from Zoom. The world is not gonna fall apart if I just do it from my house.
You did test positive, Marcella?
Yeah, really.
I've been sick
And
for,
no
I've
one
been
in my
sick-
life with whom I've been in contact with has tested positive in the last 2 weeks. So
Yeah, I've been
that's
sick.
why I say it's those pesky groceries.
Yeah, I've been sick for about 3 or 4 days and just have tested 3 times and tested negative on all of them, but still
Yeah.
kind of feel a little bit.
Could be allergies, could be the flu, could be anything.
Yeah,
I was
And
sure
it
mine
could
was
be
allergy.
COVID, but your body is just fighting it off. I mean, that's what's amazing is that those rapid tests, they only, if you don't have enough viral load, so all those times that we, think, oh, it's just a cold, our body's doing its work, right?
Yeah. Well, I was freaked out about just the thought of the neurological things that were happening to not smell and not taste, but that didn't happen to me. And so I'm just hoping for the best.
Yeah, what I have heard, if you want any advice, I'm like texting my friend, is that really take it easy. Because that also helps not getting long COVID. Like just be good to yourself for as long as possible. Don't rush.
Well, I already didn't do that. That's not true. I worked because I could,
But you're not exercising. I think those
Oh,
are the
no. Somebody told me that.
You're
They said-
tired,
They said your body is exercising without you exercising, because it's fighting this thing. I was like, okay, I'll buy that. But anyway, I will one of these days, I'm on day 9 right now, I will test negative. I'll have a little bit of a cough, but I always get a cough. So that doesn't freak me out. I don't think that that's necessarily COVID related. That's just my body and the way it reacts to these sorts of things. But anyway, so I should be good. I should be good soon. I might even have a glass of wine tomorrow.
Wow, for mental health reasons, that's good. Too.
Yeah, especially because I can taste it. Anyway, see you guys. Take care of yourself.
safe.
You
Be
too.
safe.